healthcare options. If you'd like to learn how you might pay less for your company's health insurance program and you would like more options when it comes to providing employee benefits, then your time here will be well spent. We are headquartered in Greenville, South Carolina, with executive peer advisory boards in multiple cities throughout the United States. I'll be your host today, and I'd like to invite you to stay tuned for future webinars on our website, located at the bottom of this slide, where it says www.chiefexecutiveboards.com. Before we dive straight into our main topic, you might be curious to learn more about CEBI. We are a boutique executive peer advisory service with local and national boards located throughout the eastern and Midwest states. The purpose of CEBI really is to help CEOs, presidents, business owners share ideas and experiences to avoid the pitfalls and potholes that many have already experienced. In other words, we help steer you from reinventing the wheel within your own business. Members convene in face-to-face forums, receive unvarnished advice in a safe and confidential environment. It's typically unavailable elsewhere. It's like having your own personal think tank. As an example, we address what keeps you up at night, items you don't have an opportunity to discuss with anyone else. You can avail the advisory services from local and national advisory board forums. You can attend educational summits, access other CEBI members, our libraries, workshops, and webinars such as this. A couple of housekeeping items. Your questions can be posted in the question panel box to the right, and they will be answered after the webinar session. As a reminder, this webinar is being recorded and will be made available to you to review on our website. So let's get started with our webinar. Our guest presenter, Mr. Tom Quigley. He participates as Chief Executive Board's Alliance Partner. He is the Vice President and National Business Consultant for ClaimLinx, which serves as a health benefits consultant and administrator. He has over 25 years experience in the insurance industry, and he uses his knowledge to be a true advocate for the business owner. His main focus is on reducing healthcare costs through a unique solution. Their strategy for buying health benefits has saved businesses millions of dollars on health insurance. Today you'll learn that it's possible to make a change with your health care plan and see significant savings. For most companies, purchasing health insurance is one of the top expenses. It really doesn't have to be that way. There are viable solutions that can save you up to 80% on your health care cost. This webinar will last approximately 45 minutes, and we'll take a few minutes at the end for questions. Contact details will be listed at the end of the presentation, and at this point I'd like to turn over the webinar to our featured presenter, Mr. Tom Quigley. Tom?
Thanks, Kevin. What I'd like to do is run through the PowerPoint and then answer any questions anyone may have. If you don't mind, we can start it right now, Kevin. What I'd like everyone to do is go back to 1985 in your mind. In 1985, we didn't have high-def televisions. We didn't have the internet. We didn't have cell phones. Almost every town, small town, had a video store and a travel agency. So what I'd like to do now is let's fast forward to 2015. Now we're on to the smartphones, not only the cell phones, now they're smart. There is very few, if any, video stores remaining, along with travel agencies. We now have high-def, curved TVs, high-speed internet. But one thing hasn't changed since 1985, and that is how people buy group health insurance. The insurance carriers are still trying to train their insurance agents how to sell based on 1985. Yet, during that time frame, the COBRA laws came in, Section 125 premium-only plans and flexible spending accounts came in, the HIPAA laws came in, the health savings and the HRAs came in, and yes, we have the Affordable Care Act that's now in. Yet, with all these new tax laws and laws regarding health insurance, people are still buying and being shown how to buy the same exact way as 1985. So with that said, when I was in business school, if you don't mind flipping to the next slide, Kevin, I was taught that a for-profit business and any business, you have a balance sheet and you have assets and liabilities. What most people have to understand as an employer, your health insurance is a liability, and an increasing liability, it seems, every year. The employees view health insurance and benefits as an asset. Yet, doing the same thing and increasing the deductibles and the employee's costs is creating more of a liability than an asset for even the employee. So with that said, let's move on to some lessons in health insurance versus health benefits. The new law, the Affordable Care Act, requires insurance companies to have plans that have catastrophic coverage for the essential benefits with no limits, annually or lifetime. Every plan sold since January 1st of 2014 meets this requirement, and cover preventative care with no limits, physicals, immunizations. Those are all now covered. So the insurance plans all have those coverages. What everyone's doing, though, not everyone, most people, is their decisions are they buy a group health plan that covers the co-pays, the physician office, they have lower deductibles. So what we're trying to show people, those are the benefits, the co-pays. The insurance piece is the catastrophic and now the preventative that are built into the insurance products. Okay, the next screen. For traditional group plans, people are buying one neat package where the insurance companies provide the co-pays and cover everything, and you just show them your card, and you got to make sure you're in the network, and you're prepaying claims. And if they don't use them, you don't get your money back. Okay? So, most companies, you have a company car. Most companies do not buy oil change insurance, tune-ups, or gasoline insurance. The reason they don't do that is because they self-fund that. They do it themselves because it's much cheaper than paying the insurance company all that extra money to manage that for them. So when it comes to their other insurances, they're doing the total opposite of what most people are doing on their health insurance. So with this logic, let's move on to the next slide. We came up with 4 different plan designs in the spirit of the ACA. We have the diamond, the sapphire, the crystal, and the plus versus the gold, platinum, silver, and bronze. So on to the next screen, we have the idea here is regardless of the flavor of insurance that you buy for the company, what we're trying to show folks is it may be in the best interest, may not, to purchase a high deductible health insurance plan through the same insurance carriers that they may be using. And the higher the deductible, the less expensive the plans. And since the new law covers all the physicals, preventative, and immunizations, along with the catastrophic. All you do is you fill in the gap. It's as simple as self-funding your oil change, your gas, and your tune-ups. So with that said, on to the next slide. What we recommend that may be in the best interest for people is to set up what's called a medical expense reimbursement plan so that you can still provide tax-free benefits to the employees in the write-off for yourself. And this is a 1954 tax law that slides under Section 105B of the tax code. It's been around since 1954 for the companies like Procter & Gamble, GE, and the federal government to self-fund. What we do as a company is we manage our ideas. Advantages to providing the MERP is you literally can customize your benefit plan for your company and for your employees that meets their needs and the company's needs. The other thing that you get is the claims for your company, so you can make informed decisions. The problem with group health that I've had is they give you one or two plans. I'm talking the traditional plans. The MERP is a group health plan also, but what we're doing is we're providing the claims analysis, and you do not get that with the insurance companies. They do not tell you that, hey, you paid us $300,000 and we only paid out $100,000 in claims. They don't give you that kind of analysis. With what we're doing, we do. So you can make informed decisions on things like emergency rooms or office visits, whether you should have a lower copay or a higher copay. And you're no longer prepaying for services under a medical expense reimbursement plan. The only part that you are is for the catastrophic piece and the preventative piece that is built into the insurance products that you have. So let's look at this in a view. You purchase a high deductible health plan from a major medical carrier. You set up a medical expense reimbursement plan. The employer shares in some of the responsibility, and the employee shares in some responsibility. And after a certain point, under the law, the insurance carrier picks up everything for the remaining calendar year with no limits on the preventative. So if somebody's in the hospital for 2 months, the employer is not getting a $1 million claim, the insurance company is, and the employer's simply having the employee share in some of their deductibles and out-of-pockets, and we're simply reimbursing the employer's responsibility. Okay. So, in the spirit of the law, the Diamond plan, all we're doing is we're taking a traditional group health plan, going to that same insurance carrier, asking them to go to a higher deductible. So let's say you're at a $2,000 deductible. We're saying go to a $5,000, and we're showing the companies that you get instant savings. You can customize your benefits. Pretty simple administration. We'll touch on that in a little while. You have access to physicians' networks, and you have the opportunity for future savings. The cons to this plan is you're not going to save as much as the other ones you'll see in a moment, and you have to educate the employees, because the problem I have when I walk into most companies is most employees don't understand what they currently have. So if we try to mimic what they currently have, they may not understand it. So a lot of times we're able to improve the benefits, so they do understand it. The next one is the Sapphire plan, and what we're doing there is showing companies that you can use the same carriers and buy individual health plans, and the employees can choose what carrier they'd like. If they leave the company, it's portable. They own the plan. And because of the way the new law and actually previous laws were, individual health insurance is much cheaper in most states than traditional group health insurance. So you get greater savings. You still have everything else. That's the pros, and you still have cons. And some of the cons are the doctors' networks may not be as expansive as the traditional group, but that can be checked, and they can customize whatever individual plan they want. And as a business, that medical expense reimbursement plan is a group health plan, and if designed in accordance to the ACA, you have a compliant health plan. The third way is the Crystal plan, and for companies under 50, this is a very good idea. Simply have an unaffordable health plan that allows employees to take advantage of the tax breaks, the subsidies. As a company, you have more savings. You still can do everything else all the other plans have. You may have an extra con as multiple policies, and under the law, regardless what flavor of insurance you have, there are some tax filings that are required that accountants in H&R Block will do. Go on to the next screen.
Bear with me, Tom. We're getting there.
Okay. Another idea that we've been using extensively out on the northeast corridor of this country, we have Aflac agents who love this idea, is we have business owners who are giving their employees an allowance or a bank, $50, $100, whatever they choose, and the employees can literally choose whatever Aflac-like products that they want. So they could purchase a cancer policy, a disability, a life, an accident, that may, a hospital indemnity that may cover their higher deductible that the plan has, and it may cover experimental treatment, and these plans are also portable, just like the individual coverages. So the employee, if they terminate with the company or for whatever reason, retire, they still have benefits. This is really popular because of the savings. So we can move on to the next screen. So our last plan is incorporating these plans. Pros are the employees. The idea is to create more assets for the employees on their benefit plan. There is no better way. Opportunity for more health services, and the employees have the ability to recoup their out-of-pocket costs, and the owner can still customize their plan. The con for the owner is there's additional costs out of their savings. Here's an example, 33 lives, New Hampshire company, high deductible group plan with the MERP, and using Aflac, they're saving $7,400 a month for 33 people. This one's 73, high deductible using individual plans. Again, using the benefit bank, they're saving $28,515 a month on average for the first 4 months of this year. The difference with this program is you have 2 cards versus 1. You still have your major medical card. Now you have a secondary card, which is the employer-funded plan that is managed and we're filed as secondary. And the way it works at the doctors is the provider bills the primary insurance. The primary insurance carrier determines the coverage. They generate an EOB, stands for explanation of benefits. that they send to both the employee and the provider. The provider turns around and files it to us like they do Medicare secondary, and then we turn around and we bill the employer and pay the doctors and hospitals directly. The employee still pays the same as they did before or better, and they also get an explanation of benefits from us. Generally at the pharmacy, they still pay their co-pays. There is no change in that. It's just for doctors and hospitals. Okay, so let's wrap this up. What we are as a consultant, we're looking for the best benefits within a budget. The traditional ways that, as I mentioned from the beginning, that have been sold the last 30 years are the most costly. And we work on savings, so if we're not saving money, we're not earning. But then we have our little pig that wants to store some of your money. And if anyone has any questions, feel free to ask them.
We do. We have a couple, Tom. I've got a few from Jordan. The first of, well, it's two-part. First is, how is a MERP different than an HRA? And then the second one probably needs a little bit more explanation. Can you provide a real-world example of how a company would establish an SOS plan, and why would they choose that?
Okay. A HRA uses the same tax law. In fact, George Bush basically renamed Section 105 plans HRAs. The law was already in existence. The difference is there's no carryover credit with the MERP, so you don't carry over claims if employees aren't using it. There's no carryover credit, which you do not want to do. Most HRAs are depends. They can be designed identical to a MERP. It's just the same tax law. Nothing really has changed with it. And the second part of the question was, how do you...
a real-world example of how a company would establish an SOS.
Okay. You have a Blue Cross plan, and you're in Illinois. And you have a plan with a $2,000 deductible. We take the most basic approach. We go to Blue Cross Illinois, get their highest HSA product only, which would be a $5,000 deductible, use the same network of doctors. It's a PPO, and literally between the $2,000 and $5,000, we designed the plan identical to that $2,000 plan. Nothing changes in terms of the benefits. The employees then turn around and use two cards instead of one. But at the end of the day, the difference in the savings that are generated will cover the usage of the employees and keep the money in the account of the owners. You do not pre-fund anything. You keep the money in your own account.
Okay, and we have a question from Carly. And she asked, how come we haven't heard about this solution from other companies?
Insurance companies are not fond of you using their products that are the most inexpensive and creating better benefits than they provide. And they train the insurance agents and give them bonuses based on premium, the larger agencies. So if you have $100 million in your book of business of premium, their incentive to, if you're earning 5% bonuses, that's $5 million that you get each year just in bonuses to reduce your premium to $20 million. You've taken a huge pay cut. Big agencies don't want to do that. Don't blame them.
Okay, and Tom, I need to clarify. Apparently, Jordan was asking, he wanted to clarify. His question was about the SOB, not the SOS, the selectable benefits covered by the MERP.
They're all outlined in their Section 213D expenses, and the IRS puts out a publication 502, and in your plan document you can design whatever expenses you want to include and not include within the MERP. Generally, the way we do it is we mirror the group plan, so whatever the group health insurance carrier doesn't cover, you do not cover either in the medical expense plan.
Okay. And we have one from Michelle. How do you decide which type of plan, individual or group, is best for your company?
Generally, we want to get the accountant, the CPA, or tax attorney involved because there's conflicting guidance, proposed regs, proposed laws, and the actual law. So if accountants want to follow the actual law, then most of the time they're recommending their clients, particularly if their group's under 50, is to design a plan that is unaffordable under the Affordable Care Act, take full advantage of both individual and subsidy plans. But since it's a tax law, we make sure that CPAs and tax attorneys are involved in the process.
Okay. And let's see, we can take two more. This one's from Keith. Do you foresee any major changes to the Affordable Care Act that will change your benefit strategy?
No, but the Supreme Court will make all the states, in my opinion, go have their own private exchanges and create chaos by flipping the, because the federal exchange, they're going to, in my opinion, say that that's not part of the law. So we've been doing medical expense reimbursement plans since 2002. The HIPAA laws are the ones that really created the difference in the gaps. And then the HSA and HRAs that came in 2004 and 5 were huge also, because it gives a huge gap in pricing. So we really don't care what happens with the law, but we do know that this law is a huge opportunity for companies if they're willing to follow the law.
Okay, and the last question is from Marcus. How long does it take to implement?
Depends on how conservative or aggressive. If you're using a group plan, you could literally change it. Like today's May 13th, you could change it for June 1st. Where on the other side, if you're using individual or subsidies, it may take a month or two extra, so you may want to start August 1st.
Okay, and we did have several questions that were pretty specific, and we will get to you on those. We will have Tom contact you directly and answer those questions. Right now, I'd like to turn it back over to Kevin.
Okay, thank you, Robin.
Thanks.
All right. Really, this concludes our presentation. Here's the contact information for ClaimLinx. If you'd like to contact Tom Quigley, you can contact him via these contact details here. And again, this presentation is recorded, so and it'll be sent to you in the form of a web link, so you'll have this data and this information available to you. This webinar was hosted by CEBI, and I'd like to invite you to visit our website for additional insights and upcoming events, such as the webcasts that are listed on this site. So we do have a couple more coming up here fairly soon. This is the contact information for Chief Executive Boards. If you have any questions for us, please feel free to reach out and contact us. At this time, I'd like to thank our presenter, Tom Quigley, and I hope you found this to be helpful. I want to invite you to contact Chief Executive Boards with any questions, and please join us for future webinars. We look forward to speaking with you regarding future engagements with CEBI and ClaimLinx, and wish all of you a great week ahead. Thank you. Well, yeah, thank you, Tom. And this concludes our webinar.